So she came to us in the 5th month. We could see that we can't see a nasal bone. We could see that. We got to see, is this baby becoming anemic or not. And then once we diagnose that the baby is getting anemic and we have charts for it, then we do transfusion. So this very typical case.
Hello and welcome to Awaz, the Voice Interviews. I am Nazir Ganai. Today we are joined by a very special guest. She's the daughter of the soil and an expert in fetal medicine, Dr. Anita Cole. She's currently clinical director and consultant in fetal medicine and genetics at the Apollo Center for Fetal Medicine. Dr. Sahib, बहुत शुक्रिया.
Hello, thank.
A lot is being said, and you also get the chances to attend these conferences, seminars, conclaves, and fetal medicine is something that needs to be talked about. So, what is this fetal medicine, and how should expecting mothers, take care about this?
So, I sincerely believe that fetal medicine is a specialty which has been in the West for the last 20 years, more than that, 20, 25 years. In Delhi for the last 15 years, but in Srinagar, where I do believe there is a need for it, we've made no progress. Essentially, we believe that in a pregnancy, the fetus is a patient with its own problems, its own rights, its own need for medical therapy, surgical therapy. So therefore, to treat the fetus as a patient is integral to make sure that when this this baby is born, it is mentally of good health, physically of good health, and also as it becomes an adult, it is of optimum health. Have you heard of this concept of the fetal origin of adult disease? So, usme we believe that how healthy we are as an adult depends on how we were inside the womb. So, वो हमारे लिए बहुत important है कि it should be optimum. For example, say gestational diabetes. Mothers, जो अभी इंडिया में काफी common हो रहा है that gestational diabetes is a problem. So, अगर this is not optimized during pregnancy, this baby as an adult will become a diabetic as well. So वो पूरे time हम लोग monitor करते हैं using ultrasound, using measures to make sure this doesn't happen. The other problem I feel in Kashmir is because there is intermarriage. There are
because the society is like that.
The society is like that. So there is marriage between cousins and things. The genetic disease is slightly more in Kashmir than it would be, say, in Delhi or other regions. Now, genetic knowledge has moved forward so much that we can prevent the birth of intellectually impaired babies. There's a Down syndrome, even if we leave aside consanguinity, even something like Down syndrome, जो is the most common cause of mental retardation worldwide. उसका भी basic universal check नहीं होता. Every pregnant woman should have Down syndrome screening.
Okay, there are some examinations, like Torch test is sometimes advised to a patient.
Correct.
But then there's not so much awareness about it. Sometimes doctor may advise, okay, we have to terminate the baby or we have to terminate this fetus and all. But at the same time, it varies from place to place.
It does. Like for instance, you brought up Torch. So Torch ka one virus is the cytomegalovirus, CMV. Now CMV can go up to the brain and it can cause mental retardation. But we have drugs now which can treat CMV. So agar by chance, if I know that my mother has had exposure to CMV, and because we are alert for it, if I put that on antivirals like valsiclovir, there are medicines, they are born fine. They don't have deafness. CMV can cause intellectual disability, it can cause deafness, it can cause in some cases blindness. वो हम prevent कर सकते हैं. But knowledge तो है कि
now that you come from a facility, come from a hospital which has a sophisticated machinery and the human resource as well. But when you talk about India in general, you know, hospitals in general, and you go to far off places where the basic amenities are also missing, how would you, you know, advise doctors at that level to actually go for these kind of, you know, examinations?
No. Now, that is not the case. The government of India has made it mandatory that every woman should have a fifth month scan. The government of India has made it mandatory that kuch tests need to be done in the first part. Now, so when we talk about mandatory scans, we certify people कि जो भी doctor है, whatever machine you're using, you have to take those 20 planes of scanning. If say agar fifth month scan, you have to take 3 planes of the brain, you have to take certain planes of the face, you have to take certain planes of the heart. Or usko, if you don't do it, it is substandard scanning. तो वो हम लोग insist नहीं करते हैं. The government.
और अभी I think government has also brought these expecting mothers under the schemes. और कई states में तो free भी
नहीं, see, one is कि technology, but certain things don't need such high technology.
Yeah.
They just need the doctor to be trained to do it. So उसमें I think the government should make short training programs where they send batches of doctors and they say that look, and now actually we do simulation because जब से PCPNDT makes it difficult to train doctors because of sex selection, simulated training is the way forward. जैसे, you know, pilots, they're trained on flight simulators. Yeah. Similarly, we now train doctors on ultrasound simulators. Okay. Look, these are 20 abnormalities. You need to know how to recognize it. You need to know how to pick it up. You need to know how to counsel these things. So unko they are trained in workshops. But the government should take this initiative so that they train their doctors better. They can't use the excuse of अच्छा हमारा machine is not top end, so हम नहीं कर सकते. That is
gestational diabetes is another major concern for the country. And यहाँ पे खास तौर से जब हम कश्मीर की बात करते हैं, in fact diabetes has taken an enormous range of magnitude now. तो कैसे इसको जो expecting mothers है कैसे इसका ख्याल रख सकती हैं?
So first is before you get pregnant you need to check. Because making sure you check your fasting and postprandials and you do your HbA1cs. And then throughout pregnancy, like 3rd month maybe check kare. If by chance you land up having gestational diabetes, a lot of women are scared of going on insulin. Because insulin is a natural hormone which optimizes sugar, and they're scared on going on that कि नहीं अगर एक बार हम दवाई ले that means we'll be. And so they keep trying diet से manage करो. That's not a good thing. It is better. Agar by chance we need to switch from diet to medicine, switch, because your baby will become a diabetic. You have to be 24/7 absolutely sure your sugars are perfect. So and now there are things like continuous glucose monitoring. You know, chips come where you stick on a chip and move 24/7 is monitoring your sugar to make sure it's optimized. How much is it in range? How much? I mean, there's a lot which is happening. But the point is to be aware that agar within a week it's not controlled, let's move on to the next step higher. We don't drag months and months of not bothering.
In Kashmir, we have seen a sizable population without child. So childless couple बहुत है, और there are different kind of stories that come. कि मैं IVF के भी मैंने अवेल किया, फिर उससे भी नहीं हुआ. मेडिकेशन बहुत टाइम रहा, उससे भी नहीं हुआ. तो is there any golden principle when someone gets married? Is there any golden principle, after checking the parameters and all, how they should go and they should start kind of getting into this?
So definitely, well, I mean, what a lot of couples now are doing, I can only speak what's happening in Delhi, is they come to the preconception clinic. So they actually, as soon as they get married, before they're planning, they come for preconception counseling. we do a lot of tests. One is, of course, diabetes, thyroid, infections, making sure that they're immune. For example, if they're not immune to rubella, which is one of the torch things that they're immune. We also do something called carrier screenings, genetic carrier screenings. Is there something that may, say, be there in you and your husband, which may cause problems later on, that we address in now? We have tests where we look at the ovarian reserve. What is the potential of fertility? So, for instance, if the reserves are low, we say no, plan your baby sooner. If the fertility is good, okay, they can take some time. And now you'll be surprised, but a lot of young people actually store their eggs, because as you know, as you get older, your fertility decreases. So they come in and say that, like, even college children now, they're saying, no, we want to concentrate on a career. We'd rather store our eggs and freeze our eggs, finish their career, and then maybe at 37, 38. I'd probably say that if you're getting married, it would make sense once to meet your obstetrician and at least do a basic check.
Okay, very interesting question. What is the age when one should get married? I mean, is there a particular...
Marriage is different, the children bit. If you go scientifically, then yes, you should think of having children in your late 20s, early 30s. That's probably the right time. But where life takes you. Now women want careers. They don't want to be stuck. So they delay it. So we are finding a lot of...
And there are lots of unfinished assignments for both the sexes. And coming back to your core area, which is a fetal medicine and genetics, do you think Kashmir needs some kind of intervention on that scale? And is Apollo going to kind of do any kind of...
So we are running a postgraduate program. So we run programs where we see, so we're running one with the University of Barcelona, where we're saying that, okay, maybe online classes, even if you don't want to come outside the valley, come for online classes and sort of upgrade your skills. So maybe that, but we haven't yet worked with the government whereby we can do batches of doctors. Years back in 2015, we'd come here to do a teaching program, and at that time the government had sent the doctors who, because every PHC here has got an ultrasound machine. It's not that our resources are that bad. So the government had actually sent them to Srinagar and said, we'll attend these workshops. So it would be good if the current government...
Okay, given a chance, Dr. Anita is given an assignment. Okay, you go back to Kashmir and restart or resume your work.
I would.
Where would you start? Or why would you resume again? In the...
No, if I get a chance that I come here and start fetal medicine services, I would definitely take it, because it's very challenging to start anew and actually disseminate. What I want is to train doctors. One person cannot do. Our aim is that you you train the next generation so that they can reach out to more people. As has happened in other states.
Okay, one last question is that, if an expecting mother is suffering from breast cancer, so is there any different protocol for the mother? How could be the treatment from the concerned doctor or gynae?
So normally we look at the gestational age at the time that it's been diagnosed, because you're always putting the mother versus the baby, the rights of the mother versus the rights of the baby. Generally speaking, if she's crossed 7th month and we have a viable pregnancy, that means that if the baby is born, we would be able to have a live baby. We would tend to give milder medications, chemo and all, just to buy time to get this baby mature so that we can do an early delivery and things. However, if it comes in the first trimester, where there's a long way to go, then actually you look at how aggressive is the tumor. So there are lots of things.
There are lots of phases also. So Dr. Anita Kaul, thank you so much for being with us, and We'll definitely
pleasure.
get back to you once we're in Delhi.
No,
बहुत
right.
बहुत शुक्रिया.
Thank you.